The South Carolina Department of Health and Environmental Control released new data today about the death of babies. That information from DHEC shows that infant mortality rates in the state rose 12% in 1 year. The news comes as national data shows that infant mortality rates are at record lows in the U.S. Emily Zuhowski tells us more.
It is incredibly sad and an unimaginable loss that no parent should ever have to experience.
Losing an infant is tragic beyond belief. And here in South Carolina, more and more families are having to face it.
The birth of a baby is supposed to be a really exciting occasion for families, and that there are families who aren't experiencing that excitement.
According to DHEC's 2023 infant mortality report released Wednesday, South Carolina's infant mortality rate rose by 12% from 2020 to 2021 and rose almost 40% since 2017 for infants born to non-Hispanic Black mothers. The report blames congenital malformations or birth defects, disorders related to short gestation and low birth weight, and causes related to maternal complications of pregnancy as the leading causes. But DHEC also found that the number of children who died from sudden infant death syndrome, or SIDS, more than doubled from the previous year, and the total number of infant deaths was the highest in nearly a decade. The DHEC report also shows disparities in our state. Black infants are dying at a rate nearly 2.5 times that of white infants.
While we know that Black infants die at a rate of 2.5% higher, we also know that Black mothers die at a rate of about 3.1% higher than that of their white counterparts up to a year after birth. And so those are really large gaps. And again, those gaps that we see are happening or because of some of our understructure of systemic oppression and racism.
The issue of infant mortality is complex, and there's not a quick fix, but there are many groups in the state working together to help.
We're looking at how can we improve access, how can we look at economics, how can we look at telecommunications, anything that we can to improve care to moms early in the pregnancy. It's just very important at this time.
In Charleston, Emily Zuhowski, Live 5 News.